So I am talking as an individual practitioner where there are two doctors, me and my wife, and we have a new setup. So as we have heard, we are entering uncharted waters. The curve may flatten, but the corona will keep rearing its head. We cannot compromise on quality. So what we have to do is good practice, tighten our belts, and better financial management. So what are the problems at hand? Cash flow crunch. There will be no work during lockdown. There's reduced volume for next 6 months. There are increased expenses. These are all the anti-COVID measures. There's money stuck in the panels. And since, as Dr. Rambuti said, the whole team is my extended family, so it's all emotion driven. We have to maintain high quality with limited resources, and this is a new normal which you're going to have. So we have to innovate. So there's a reduced cash flow. Patients will prioritize, they will avoid premium IOLs, they will avoid refractive surgery, but they will go for emergency procedures. As Dr. V said, a blind person is a mouth with no food. So we should not buy new equipment unless and until it is mandatory and we have adequate cash flow. We have to take care of the extended family, maintain their health, get to know them, how they are handling the crisis, and accordingly take the measures. We have to have robust anti-COVID measures, hand washing policies, and various other anti-COVID measures. Whatever we do, it should be transparent, clear-cut policies which should come from top to bottom, and we should do some organization belt tightening, which I'll just show you. So what is important in our practice today is a pure cataract-based practice may not survive as well as a practice which is pan-ophthalmology, which means cataract, retina, glaucoma, trauma, and the other specialties. We have to have innovations. Therefore, we must ensure that we categorize all areas of our clinic from the OPD reception to the optometrist, to the consultant, as to what all PPE measures we will adopt, which are safe and as per policies. We should reduce our consumable costs. Like for us, it is just an example, the Arora needle trocar cannula system. We have to support each and every personnel within our organization, like the guard here, and everybody is provided with a face shields and a mask. And this is a small little video which says that you have to do this jugaad.
Tape here, tape below, make sure that it's completely closed. How do I check it? So I put my fingers here and I blow. And I check for any leakage of air. There is no leakage of air. When I suck it, there is nothing coming in from the sides. That means I know that this is completely airtight. So this would work as efficiently as an N95.
So these are some of the measures which we have to do. We have to encourage patients to do cash payments. AIRS has to push for TPS and panel releases of payment. I do not know if we have to increase the rates because patients have also problem. They will actually be asking for discounts. We have to give charity to the vulnerable patients. We should club surgery so that we reduce our costs, and we have to adopt good anti-COVID measures. So regarding the rent, as everybody said it, we have to renegotiate our agreements. We have to use our electricity judiciously. There have to be moratorium on AMCs, and all these things have to be talked about. I'll come to what we are thinking in terms of staff. We have paid them completely for March. Regarding April, the center was closed, but we got a notice from the CM. So we opened it on 8th with reduced timing for a few hours. All those people who are absentees, we will give them a substantial disaster allowance whether they come or not. So those people who come for the first 7 days of not coming, we will calculate the disaster allowance, and rest of the people will get most of the salary. That is almost about 80% of the salary. And I agree with Dr. Ramurthy that we have to understand their situation, and maybe sometimes we have to personalize. We will have to judicially use this leave, extend their working hours, and I do not know if we have to cut the salary, but this may be graded beyond a particular amount. The vulnerable people within our extended family will not have a salary cut. So the take-home message is COVID is not a dream. I get up in the morning and sometimes I think, is it really COVID happening? But it's real. It's there. We have to fight it. We have to fight it together as a family and as a nation. We have to innovate and make in India solutions. The IOS has to help us in getting our payments released, reducing the custom duties in future. We have to have quality control. We cherish our customer satisfaction. The patient's flow should be kept with social distancing in mind. Charity begins at home, so take care of your extended family. We must have prefer compassion over capitalism. We should retain our trained staff, and we should make sure that some of the staff may not be working some other practices. We should not poach upon any of the staff from any other practice. Smaller centers with lesser overheads may do slightly better. Thank you for your kind attention.